Hey everyone, welcome to another episode of Make America Civil Again. It's your favorite YouTube interviewer. Today I will be interviewing my aunt on healthcare. So before we begin, I always say like, share, subscribe, and hit that notification bell so that every Wednesday morning, bright and early, you are notified that your favorite YouTube interviewer has posted a new video. All right, so today I am with my aunt. How are you?
I'm great, thank you.
Awesome. And today we're going to be talking about healthcare. Now, she spent a lot of time in the healthcare field, and so I felt she would be an excellent resource to talk to when it comes to the healthcare stuff and all things like that, because it's a hot button issue these days. And I can claim some ignorance in that area. But before we begin, I always have to ask, who are you? Tell us a little bit about yourself.
So who am I? Well, I'm your aunt.
Which I'm thankful for.
Me too. So I am a wife, a mother, a grandmother, a follower of Jesus, absolutely. And as you said, I have been in healthcare industry for quite a long time. I'm actually a nurse by trade, and I've been a nurse for almost as old as I am, I think. It's been over 30 years, so it's been a long time.
Oh, okay, yeah. So 30 years in the nursing field.
Yeah, more than that. But,
okay, we'll just go with that.
Yeah, that's good. That's good, because I'm 32, so.
Yes, that's right. So since you were 2, you've been sticking needles in people's arms and all that. So I believe that you, and plus your mom and your sister, are the reason why my wife wanted to become a nurse. Is this true?
I hope so. Yeah. I'm actually honored because I feel like she's followed in my footsteps to start with, so that's been really cool. We both have the same passions.
Yeah, definitely. She worked on the floor you used to work on, and so all
same
that.
Hospital. So long ago.
Yeah,
it's been great.
Yeah, about 15 years ago. Since you're 32, so that's when you
were
17,
true. Right?
Or so around that area. You've been a nurse for 30 years or so. So, what have you done as a nurse? Like, what different fields have you worked in as a nurse?
So it's been a really great journey. Nothing planned, actually. When I got out of nursing school way back when, there wasn't a shortage of nurses. And so basically at that time, you had to take the job where it was opening. And I just happened to take a position that was available that turned out to be my passion in life, and it was oncology. I did adult oncology. So I worked at a hospital for almost 15 years, working with cancer patients mostly.
Okay.
And that's kind of when I realized my passion was not just for healthcare itself, but mainly for the older adult, and also psychosocial, which we now call population health.
Okay.
Looking at all the aspects of a patient.
But it took you going into oncology for you to realize, like, this is really what I like?
Yeah, it was pretty much after I got out of nursing school, and so, you know, we had rotation in all different aspects, and so I realized that's kind of where my niche was, which led me down to case management, and I became a case manager, as well as, oh gosh, I did home health and I did all kinds of other things. I ended up actually in managed care, which is a form of Medicare Advantage. So my heart has always been to the older adult, and so the managed care form where I became embedded in has really helped me to be able to help patients have the best health care that they can.
So in layman's terms, can you explain to us like what Medicare actually is?
So yeah, so Medicare is a federal program, and it's usually for age 65 and older, but there's other situations where you can be eligible for Medicare. So Medicare actually is what the federal health care. So we have Medicare and Medicaid.
Okay.
So those are kind of the two aspects. So Medicare is federal, Medicaid is run by the state. So I've kind of gone a little bit different from that to the managed care, which is a Medicare Advantage type of situation. So it's all Medicare benefits. In addition, there's also extra benefits that are able, and one of those things is case management, that it provides case management to patients. And what I found in my many years of working in clinics as well as the hospital and outpatient case management as well, a lot of what older adults have challenges with is navigating through the system. And so whether it's medication, whether it's a referral to somebody else, whether it's going, not sure what the next step is, that's what case management does. And really helps that patient go through with what they need to try and increase their level of care, their self-management, and be able to take care of themselves.
And is that state and federal? Is that ran by the state and the federal, or is that like a private sector thing?
Usually it's private sector. There definitely is. The state is very, very strong in their case management with the Medicaid. A lot of that is run by social workers, which is a definite positive thing with nurses and social workers working together. The nurses with our clinical expertise, so we're able to help navigate even getting medications for the members, working with the PCP or a specialist, making sure that if home health is necessary, to have them come in and help with home health or physical therapy, whatever that situation arises. A lot of times it's initiated, unfortunately, after an episodic event, which means that they go into the hospital for some reason or another. One of the big, there's a lot of initiatives that Medicare is focusing on, but one of the big ones is falls. And a lot of times with falls, patients won't share that they fell because number one, they'll think that someone wants to take them out of their home, and number two, their children, if their children live far away, they're going to say, oh, you can't live by yourself, you need to come live with me. And we all want to be independent as possible. So it's kind of challenging to navigate that system, to try and pull it out of them so that we can only help, whether it's grab bars, throw rugs, physical therapy, whatever it takes to help them.
So Medicare and Medicaid are running out of money, apparently. And so like people are talking about going to like a single payer healthcare system. How do you know how is that like different than like Medicare and Medicaid? How is that different than?
There's pros and cons to all of it. I mean, there really is. When you look at a single payer, you think that's all inclusive, and it's, that provider, whoever it is, or doctor, is going to know everything and is going to be able to take care of that patient. Ideally, that looks like that would be the best thing to happen, but of course, with the population, the volume of patients, and the access issues that we have just with primary care providers, even for us, non-adults, older adults, those are kind of some of the things that you can't just you can't box them in like that to be able to do that. I think the notion and the idea is great. What I do think that is better is that we have a healthcare team. And what I've noticed, at least in my career, is when you have the healthcare team, you have the doctor, you have the physician's assistant or nurse practitioner, you have a nurse that helps, you have a social work that helps, you have physical therapy, you have a lot of, it's an interdisciplinary team that you have that can help. I think those are the best ways to look at that, of how you can help individual patients, because there's many times where a nurse can work with the patient, and I'm a nurse, so it's not like we're better than doctors, but we know that they need us. But ideally, we can help them get through the daily needs that they have, where a doctor can diagnose and prescribe, right? And then they leave it to us to figure out the minutia. What about the daily? How do you get dressed in the morning? Who helps you with your shower? How do you get in and out of the bathtub appropriately? That kind of stuff. So I think that that's why the healthcare team is probably the best way to do that. And I feel like with the shortage of doctors that we have and access to care, the more extenders and helpers that we can manage the patients appropriately better. I kind of deviated away from your question, but that's kind of really what I'm thinking more would be helpful to the patient, and it's not cost-wise, because it actually wouldn't cost as much to talk to a nurse or to talk to a nurse practitioner than it would be to, especially in the ER visit, because you're always going to have a copay when you go to that, kind of thing.
And so like that's what they say, like with like a single payer healthcare system, like you don't have a copay. Like you don't ever have to pay anything. You just go in and you can come out, right? And like that's like it.
So, and there are programs like that in place today. Some of the Medicare Advantage programs do have that. That if you go see your PCP, there's no copay.
Oh, okay.
So you don't have to do that. You know, some of the challenges, of course, is you have to have a referral to go to a specialist.
Okay.
But really, that's just preparing the specialist to tell them why you're sending them there. You know, why you're sending to cardiology. You know, something wrong with your heart? Should be. If you're going to go to the cardiologist, you know, it's not just a checkup type thing. So really, those are what those referrals show. Is that, you know, there was a situation that happened, an EKG was abnormal or something that happened. So we just want you to check them out and make sure they're okay.
It's actually kind of comforting to know, like, hey, like medical professionals care more about the people, and you have all these politicians arguing about these ideas. When you're just like, hey, we just need to take care of people.
You know, that's a great way to put it, because I think about that a lot. It's like, who's making these decisions? Because they're not taking care of the patient. You know, let's take care of the patient first, right? That's really the mantra of what we want to do. And you're right. There's bureaucracy everywhere, because when Medicare and Medicaid started, it was to help, and of course, something always gets in the way, and it kind of gets convoluted and abused, and that's why all these things get put into play. It wasn't meant for that, but you know, people take things to the extremes. So
but like, what about like you know, like our veterans who have done so much for our country, and now their insurance, their medical insurance is, from what I hear, terrible. Like,
oh gosh, I don't agree with that. The challenge, again, is the number of people and the number of resources that they have available for them. And that's where the challenge is, and it's so unfortunate. The waiting time to get in to see a doctor, or to get a treatment done, or to get the necessary equipment that you need. And I think it's truly it's a volume issue, that, you know, the need is so high, and there's only so many resources that can provide that. But you know, they have one of the most robust systems, electronic medical record system around. Free, their medications are free, you know, but you have to go get them, of course, you know. So I see both sides of that too.
okay.
Because the care is there, it's just being able to get in. Some people have to wait months to get in, and it's so unfortunate. But then again, there's people that really get their needs met. So you're going to have both sides of the coin, right?
All right. Is there anything else you want to add?
You know, I feel like that in every section that I've been in, the key is really taking care of the patient, trying to do the best you can to take care of the patient. And we all have restrictions and everything that we do. It's like you as a teacher, right? Trying to take care of each one of your kids individually is challenging, because you have so many, right? You can only do so much for them. So you're doing the best you can with what you have.
Exactly.
I think that's the best.
Yeah, no, I couldn't agree more. Well, Aunt Sandy, thank you so much for taking the time out to chat with me about insurance and Medicare and stuff you do every day. So I know you love talking about your job.
I do. I've been extremely blessed in my 30 plus years. I really enjoy what I do.
All right, awesome. Thank you so much.
Thank you.
Yeah, absolutely. And thank you for tuning in to another episode of Make America Civil Again. I hope you were informed and educated. And just remember, no matter what you're debating, people's lives are at stake. So that's always something to keep in mind whenever you're talking about healthcare or socialism or whatever. People's lives are what really matter at the end of the day. And that's one thing that I learned or remembered while doing this interview, that we must keep others in mind. So don't forget to like, share, subscribe, and hit the notification bell. But also, you can check me out over on Instagram. I put up videos on my IGTV over there and post something every single day. So check that out. I'll leave a link in the description below. But until next Wednesday, Yeah.